My son was sick during the Christmas. Taking him to hospital, there's no, they say strike. They are on strike. Until a child that is, or somebody that is sick that is dying.
I have a friend that is a medical doctor. They are doing skeletal work in Abuja, in Nasarawa. What's the capital of that Nasarawa state? That's where he's working. And he says it's just skeletal work they are doing. Everything is down.
These experiences portray what Nigerians seeking medical services in most public hospitals nationwide have had to go through since the Joint Health Sector Unions, JHESU, began an indefinite strike on November 13 last year. I'm right inside the emergency ward of the National Orthopedic Hospital, Igbobi Yaba, here in Lagos. And as you can see, there's absolutely nothing going on here. The same could be said of other wards at the hospital, except for a few that still have some patients who have nowhere to go. Such is the fate of 51-year-old Mr. Innocent Okbara Okere, a spinal cord patient. He shares his experience.
It has been a difficult situation since the nurses have been on strike because they are the hardest people to our patients. This is 2 months now on strike. It's only doctors that come and prescribe our drugs. We are not seeing nurses. You see my leg, you see my hand. Some patients died. Some go other areas where they could not be treated properly like here.
Behind this hardship the patients are going through is a protracted tussle between JHESU and the federal government. JHESU, made up of all other health workers except medical doctors, wants the implementation of the National Industrial Court ruling on salary adjustment and skipping of consolidated health salary structure, CONHES 10, among other demands.
We have about 11 of them. Issue of promotion of our members who have been stagnated, some of them up to 15, 16, 17 years on the same level. They've been on CONHES 14 for many years. That's moving them from 14 to 15, which is grade level 17. And that is implementing the circular from Office of Staff, Office of the Head of Service, since February 2001.
The federal government here, represented by the Federal Ministry of Health, does not seem to controvert any of the demands by JHESU. So why does it seem difficult to resolve these issues, knowing that Nigerians are being denied full access to healthcare services?
A lot of issues that bordered on relationship in the Ministry of Health, we have taken the necessary steps to address those issues with them. But there are other issues that are not dependent only on the Ministry of Health. There are other stakeholders, issues about money, issue about circulars. You know, they involve other ministries like the Office of the Head of Service, the Office of the Minister of Finance, Salaries and Wages Commission. A lot of those decisions have to be taken from other sections.
Nigeria's public health sector has had more than its fair share of industrial action. The question begging for urgent answer is, when will this current strike come to an end? Yomi Otaibu reporting for Channels Television News.